Do you remember being at the dental office and hearing them call off a lot of numbers? 223, 212, 234. Those numbers are really important. Those are your periodontal probing depths. I'm Dr. Scheurer from Tranquil Dental, and I'm wearing my jacket today because it has a nice little attachment for me to use in my description. So where your teeth are, next to the gum tissue between the two, is actually a space that naturally exists there. And so when you floss your teeth, your floss can go up underneath the gum line there. So if you think of my tooth like a fist or a hand here, and you think about my cuff, hence the jacket, as your gums, there's an actual space right in between there. And so we can take an instrument that has markings on it, so it's kind of sort of like a little ruler, and place it into the pocket, to the bottom of that pocket. And there is a natural attachment there, you have to imagine that one, of the cuff to the arm or the gums to the tooth. And so there's a natural stoppage point to that pocket, or the bottom of that pocket. And so then we can determine what is that measurement that exists there as a reading of a pocket depth. And so when you have a normal, healthy pocket, that's going to be in the 1 to 3 millimeter range. If you have a pocket depth, hi Chandra, that's a little bit deeper there, then that's an area where there's concern. The reason why you would get a deeper, well, let me start by saying the reason that we say normal pocket depths are 1 to 3 millimeters is because your toothbrush bristles can actually get down into that pocket just a little bit, gather up the bacteria and debris that's in there, and pull it out. And so too can a floss go around the tooth. This is a little bit harder for me to do with my hand, but get down into the pocket there and remove the debris that's in there. But the toothbrush bristles and the floss are only going to go so far to be able to clean that out. So that means if you have a deeper pocket, like a 4, a 5, a 6 millimeter pocket, or anything deeper, then those are areas where your toothbrush bristles and your floss cannot get to. And so that means that the bacteria that are down there, the debris that's down there, just stays there and creates an infection. When you have an infection, the bacteria down there creating this infection, it actually irritates that tissue that's attached there, and it causes that tissue to go down further. It wants to kind of get away from all the irritation there. So when it goes down further, it creates an even deeper pocket, which becomes a problem in and of itself, because again, your toothbrush bristles and your floss can't get all the way down in there to clean all that out. But the other problem is that when that piece of tissue moves down, it gets closer to your bone, and your bone won't allow that. So the bone wants a certain distance between itself and that special piece of tissue. That's called the junctional epithelium. And so if that gets closer, and says, I'm out of here. And so the bone actually starts to resorb or to dissolve itself there. And in dentistry, when you lose bone, you don't get that bone back. So you don't want to lose bone. So I thought it was interesting this week. I could show you an example. I had a new patient who came in. And so we can look at some of the information there and see how it relates directly to this topic that we're talking about today. So knowing that we want good healthy pockets that are in the 1 to 3 millimeter range, knowing that if we have deeper pockets, we're not able to clean it out on a daily basis. And so that creates an even greater population of bacteria and infection there, which creates a deeper pocket and bone loss. So in this instance, you can see these are all those numbers we're always calling off. So you can see a couple of different things. One is you can see some bleeding, lots of bleeding actually here. But what I want you to focus on are two teeth in particular. So tooth number 12 and tooth number 5 there. And so these are your first premolars on the top. And if you look at the front side there and we come right down here, you can see that there are 5 millimeter pockets on both of these teeth. So we've got not our normal healthy 1, 2, or 3, not even a 4, but we have got 5 millimeter pockets there. So here's the other thing that you can see, and I'm gonna pull these up one at a time, but you can actually see some bone loss right there. So when you're young and you first have your teeth in, your bone, when it's good and healthy, actually is convex, has like a little bump there. So in between the teeth, there'd be a little bump. And then it gets to a point where it's kind of flattened off. So that's this type of a situation here. But right here, you can actually see that the bone is kind of heading up right there. And so in dentistry, we call that vertical bone loss there. And so it's there. And indeed, it's here. So you can see that there too. So both of those teeth where we have the bone loss is actually completely directly related to the fact that we've got the 5 millimeter pockets there. So that's why it's so important all the time that we're checking those numbers so that we can see how everything is doing right now. We want to see shallower pockets because you're able to clean them on a regular basis. If we need to do some treatment to try and get you to a healthier point, then that's important because we don't want to get to a point where we're seeing bone loss. I hope that that was a good bit of information with regards to how the numbers relate to my cuff on my jacket, but no, really relate to the pocket depths and how it's so important that we try to keep those pocket depths shallow because we're always wanting to make sure that we're keeping you good and healthy.